This is Dr. Angelina with Surgicare Arts and IBI Healthcare Institute. Today we'll start talking about basic things that we talk quite frequently about on videos, but we're going to go over it one more time since it's the beginning of the year. Common questions, very basic. How to make an appointment. It's a big decision to decide to go for consultation to plastic or cosmetic surgeon. That means you have to accept the fact that possibly you need surgery, possibly you need something done, something repaired, something improved, and now what do you do next? So once you identify the surgeon you want to consult with, I usually recommend doing a couple consultations unless you find somebody very special based on recommendations of your family and your friends, or maybe somebody who operated on you before. Identify a couple of surgeons in the area that you want to go to, and obviously do your research. Make sure your surgeon that you are choosing properly qualified, had fellowship, trained correctly, have board certifications in proper specialties, right? It has to be surgical specialties in surgery, cosmetic surgery, plastic surgery. Look at their work. A lot of places like mine, transparent. Well, actually not a lot. But my place is transparent, meaning if you call ahead of time or email or text us and say, hey, what's the usual price for tummy tuck or tummy tuck liposuction or something, we can give you at least ranges of the prices. Price will vary based on specific surgery that you need. Not everybody can have exact same surgery, but at least gives you an idea so you don't get a sticker shock when you show up, right? In my practice, again, you can get that information even on a price checker we have on the website. Once you have that covered, you decided to make your consultation appointment. That's like totally not a big deal. I see a lot of people commenting on sites, on websites, Instagram, YouTube, whatever. I'm so afraid, I'm about to have my appointment with a doctor. Absolutely nothing to be afraid of. It's initial consultation. It's just to say hello, get to know each other, feel the vibe, see if you like the office, see if you like the doctor. You cannot go to a doctor that you don't feel comfortable with. You want to make sure you find a doctor that when you come to the office, you can talk to the doctor, you understand what doctor is saying, you feel comfortable asking questions. That's the main decision. Find somebody you like. So that first visit is really to get to know the office and the doctor. Make an appointment, very easy. Go on the website, request an appointment, make a phone call to get placed on the schedule. Text us, email us, DM us. There's so many other ways. Email, just, hey, this is my name, I want to come in for consultation. They'll ask you for some basic information, ask you for your phone number so they can call you, because a lot of times that's easier to do on the phone. Get you on your appropriate date that you require. Do you want to do telemedicine visit or in-person visit? If you're out of town, telemedicine is a good way to start. You get to, again, talk to the doctor or one of the staff, get basic information. If you have any basic questions, make sure that's the surgery you're going for. If you're local, come in person. It's easier. Unless schedule doesn't allow, and again, you can do your first consultation in telemedicine, so kind of like the video chat, get basics, and then later on come in person when time allows. Simple, right? During that first visit, once you're getting to know each other, we can make a plan. We can look at you and say, okay, maybe you thought you needed breast implants, but now you need breast implants and a lift, or vice versa. And sometimes I look at the patient and say, don't touch your breast, leave them alone. Same thing with tummy. Some people need some liposuction. Some people need some weight loss. We can guide you. Asking me whether I operate on somebody with high BMI makes no sense, because sometimes I do, sometimes I don't. High BMI is also a very vague number. For some people, high is 25. For some people, high is 35. It depends on your health. It depends where you carry your weight. We have other options. I can help you lose weight, right? So I never say no. I will see you and I will guide you through the process. And once you're ready, then we get ready for surgery. So the day of consultation, it should be scary. It should be comfortable. Come in, have a chit chat. After that, we make a plan. Then once you're actually ready for surgery, then we do our pre-op visit. Then you ask all appropriate questions. Only then you're going to go for surgery after all appropriate workup is done. So don't get nervous about the first visit. Simple way to make an appointment, many different ways to make an appointment. Website is the simplest to request for someone to call you. And you can send us message on social media. And if you want to know more, just let me know in one of your comments. We'll follow up, we'll make more videos, and we'll go from there.